Debilitation caninum is a type of tapeworm that attaches to the small intestine lining of a pet with hook-like mouth parts. Adult Debilitation tapeworms may reach 8 inches in length. The adult worm is actually made up of many small segments, about 1/8 of an inch long. As end segments mature, they break off and are passed in a pet's stool. These segments contain tapeworm eggs and look like moving grains of rice or cucumber seeds when fresh. After the segments dry, eggs are released into the environment. Dried segments are about 1/16 of an inch long, are hard golden colored, and can sometimes be seen stuck to the hair around the pet's anus. To mature into an adult worm, a Debilitation tapeworm egg must be swallowed by a flea larvae, the immature stage of a flea. This larvae matures to an adult flea and jumps on a pet. When the pet chews or licks its skin, the flea is swallowed. As the flea is digested, the tapeworm hatches and anchors itself to the small intestine lining to mature, and the cycle continues. Contact between flea larva and the tapeworm egg is thought to occur most frequently in contaminated pet bedding or carpets. Therefore, good flea control is very important in preventing tapeworm infection and reinfection. Large numbers of tapeworms may cause debilitation and weight loss in a pet. Sometimes the pet will scoot or drag its rump across the ground or carpet because tapeworm segments irritate the anus. Occasionally, a tapeworm will release its attachment to the intestinal wall and move into the stomach. This irritates the stomach, causing a pet to vomit the worm. When this happens, a worm several inches long may be seen. Tapeworms are not usually detected by routine microscopic stool examinations performed by a veterinarian. The pet owner needs to be observant and notify the clinic if small, white, mobile segments projecting from a fresh stool or crawling on a pet are noticed. Treatment for tapeworms is simple and fortunately very effective. A drug that kills the tapeworm is given either orally or by injection. Since the worm is usually digested by the pet before it passes, the worm is normally not seen in the pet's stool. Prompt deworming should be performed as soon as tapeworms are detected. Periodic deworming for tapeworms in pets at high risk of reinfection is recommended. High-risk pets are those with frequent flea contact. All pet stools should be disposed of promptly. Strict hygiene is important, especially for children. Do not allow children to play in potentially contaminated environments. Please ask a member of our clinic staff if you have any questions.